everybody. I really wanted to make this video to share with you what I think is one of the most overlooked and undertreated aspects of the body as bodywork professionals and manual therapists, and that's the anterior and lateral lower legs. This part of the body can cause all kinds of fascial compensations and movement dysfunction when it's not properly addressed and when it's not working properly. In fact, a lot of your patients and clients that show up that have hammer toes, plantar fasciitis, bunions, internally rotated tibias, flattened arches, too high of arches, chronic knee pain, IT band syndrome, SI joint dysfunction, cervical dysfunction, and hip and lower back problems. A lot of that can be resolved, or at least a lot of the chronic issues of why those are there can be resolved by looking and addressing these lower leg muscles. So one of the reasons that we have issues with these lower leg muscles is that everything that we walk on these days is completely flat. Like in modern society, we've made it real easy to walk. Like even in my house, I'm standing here right now, everything's completely flat. And living in Florida where there's no hills, we get a double measure of that. And even when people do live in a mountainous area and they tend to go hiking, they're usually in pretty rigid hiking boots that give stability to the ankle, so it never really goes through a full range of motion. And so if your ankle is not moving through the transverse plane, frontal and sagittal planes in a lot every day, you're gonna lose the mobility and the strength in those muscles. Now, since those parts of the body are fascially connected to everything else, if there's dysfunction here, you're gonna get a lot of problems. So I'm not going to talk about every muscle in the lower leg, the soleus, the gastroc, the tibialis posterior. Those are all just as important, but there's a lot of techniques and structural work that already works with those a lot. So what I want to do is really just give these unsung heroes and these unsung causes a little bit of love and a little bit of attention today. So typically I'm going to be talking about the anterior and lateral compartment of the lower leg. The lower leg is divided up into some fascial compartments. You guys have heard about compartment syndrome in the lower legs, and sometimes they will make a little incision or take a needle and pull out some fluid. Well, all that starts when we get lack of motion in the lower leg and those compartments get stuck together. So as therapists, we really need to think about addressing these. The muscles in particular I want to talk about today are the tibialis anterior, peroneus tertius, longus, the extensor hallucis longus, extensor digitorum, all of the muscles on the front and side of the shin. So in true Trunamics fashion, I want to address these from a functional, structural, and energetic body-centered psychology point of view. Because my lecture today is not to make anybody wrong, because everybody's right in the way they look at the body, but there's so much misinformation around the knee and the ankle and these muscles that it's led to a lot of mistreatment and undertreatment in our world of therapy and massage therapy. So at first I want to start talking about the structural aspects, at least looking at it through the lens of a structural integration practitioner. In structural integration, you guys that have taken our classes, we talk a lot about locked long and locked short musculature. So the locked long muscles are typically the ones that are being overworked and holding up the body against gravity. And the locked short muscles are the ones that are typically chronically tight from underuse or chronic flexion, never being exercised. And that's usually where the problems can occur. So if we think about the anterior muscles and lateral muscles, and I'm just going to look at this as a whole, I'm not going to be talking too much about origin and insertions because you guys know that, you can look it up. I'm trying to keep the video a little bit shorter and not so much teaching you what to do, but how to look at it. At the end of this video, I'll show you how I work on these muscles. But for a structural point of view, if your anterior muscles in your shins get a little bit tight, there's several different scenarios that can happen. So if they tend to shorten up in the front and sides, it may actually shorten and pull your body forward. Now, we're not going to walk around like a bunch of ski jumpers like this, we would fall on our face. So there's a couple different ways that our bodies are going to compensate for that. Typically, if that's short and pulled forward like this, we're going to have a posteriorly tilted pelvis because the pelvis and the hamstrings are going to get chronically tight and pulling the pelvis backwards. You can see how tight this is. And as you guys know your anatomy, the lateral hamstring is going to come down and form some of those lower leg muscles too. So that's a very important factor to think about structure. Now, I'm not going to lean like this all the time. I'm actually going to have to pull my head forward then, and then you can see how this can lead to some chronic head forward posture and that cervical curve issue. And then, of course, if that's forward like this, I'm going to have to tighten up my muscles at the base of my skull, all those sub-occipital muscles, and that's going to constantly give me tension headaches. It's going to give me some atlas subluxations because the body's got to figure out a way to get movement. It's going to jam the atlas forward or sideways to get motion. So you guys that are currently undergoing some chiropractic care, osteopathic care, anybody who's showing you an x-ray and telling you that it's going to take so many visits to get this straightened out, that's really a lot of hard work and a very long road to look at structurally, because if we get all that work done and then stand up without addressing the lower legs, you're going to go right back into that lack of a cervical curve. And that's one of the main causes of this. It doesn't matter how much treatment you get up here, it's going to come right back. So I'm hoping this will save you guys a lot of money and open your eyes that, you know, a lot of the issues up here aren't from here, it's secondary. So another one of the compensations that will occur here when these tissues shorten up is your body's actually going to straighten the legs and get a little bit more of an anteriorly tilt. So this is going to lead to some hip flexor dysfunction, and of course I'm not going to walk around like this all the time. I'm going to have to compensate and stand up like this. So I'm going to get a lot of lumbar thoracic fascia tension, over tension here. I might have a QL that's going to tighten up and give me a posteriorly tilted rib cage, and then I'm back to here. Once again, I have to stick my head out, and I'm getting the same cervical and upper cervical issues from the compensations. Now, another thing that will happen if we think about the structure, these muscles up here are going to morph into the lateral hamstring, the IT band, the hip flexor, and the glute muscles. And you guys will understand this a little bit clearer when I talk about function, but if we're just looking at structural patterns, as that fascia muscle tightens up, that's going to actually cause some external rotation in my legs because there's no motion down there. So as I walk, I'm going to start being a little duck-footed and come forward. That's going to give me some structural and bunion patterns in the lower leg. So that being said, that's one thing that I want to talk about structurally right now, is if we think about foot position and function, a lot of times if you have that external rotation pattern and this tension here, that's going to start to flatten your arch a little bit. And so if your arch is being flattened, like in this manner here, that's going to drive my knee internally. If this is all tightened, right, it's going to internally rotate my tibia, and that's going to drive my arch down, not only loading up the plantar fascia, but it's also going to start driving my toe the opposite way in gait, and it's going to start causing some bunion issues. And then also, if that's really tight, I'm going to start having some hip flexor issues, and it goes on and on and on. That's why if you see, if this is externally rotating and pulling me forward, this is a huge cause of sacroiliac joint dysfunction. Because typically, if I'm going to have tension there, that means my body's not going to do a lot of transverse plane motion very well. We'll cover that in the functional aspect. So structurally, one thing I want to cover with the feet too is everything's flat. We've kind of grown up that way. Sometimes there's not a lot we can do. Now, I've never really been a big fan of orthotics in my life because I think most of them are made with people standing in a crush box and getting an imprint of the foot, or they're standing you up and putting inserts under your feet to get your ankle to line up properly. Now that's all great structurally, and if you were just standing in place all day, might be a great idea, but guess what? We walk and we move. So orthotics that build you support really aren't a great idea. There's a company that I use and recommend for my people that if you want to see that, it's on my website. You can look to a link of that, so that they actually build functional orthotics that are going to get your feet to actually drive through the planes of motion that we have. Now, that's important for me. If I want to show you guys something here, I have the ugliest feet on record. I have a really, really high arch and what's called a forefoot valgus, where my foot is actually curved. So it doesn't matter how much structural and functional work I get, because of my rigid foot, I will never be able to pronate. So when somebody, after having some of the best body workers and functional people in the world work on me, I had somebody actually make me some orthotics and then sent me some by this company that, as you can see, a lot of high arch support, and they're cut out under the first ray. It was the first time my foot had ever pronated in my life, because if I have a really rigid arch and I can't pronate, all of these muscles will never be able to shorten. They're chronically lengthened, they're chronically locked long because of the lack of motion in my foot, and that's going to naturally give me a lot of adductor and tibialis posterior tension. Now that's a lecture for another day, but I just wanted to point out the fact that sometimes we can beat ourselves up really trying to create function and structure, and sometimes that's just genetically how our bones are. We do need a little help with an orthotic. So structurally, that's what I wanted you guys to really see and understand. I'm going to go ahead and show you the rest of my ugly feet and how that can work. So I hope you guys understand a little bit how chronic tension here can cause external rotation, anterior posteriorly tilted pelvis, and a compensation all the way up here. In fact, when in my clinic, I probably say I spend time working in the lower legs on 95% of the people that come in, because it's just such a chronic issue. And if you don't address these, you're not going to get very much long-term success in your neck, low back, knee, and ankle issues. So I hope that helps you with that. Next, we're going to move on to the functional aspects of the muscles of the lower leg. So now let's talk about the anterior and lateral lower leg in function. So a lot of the ways that function has been looked at historically is we've taken somebody on a table and moved their foot up and down and then said, oh, well, look, it's these muscles in here, they do a little bit of lateral flexion and some dorsiflexion. So yeah, that must be what they do. But they do when you're laying on a table, but in real life, if you're out walking and moving, how often are you pulling those muscles up? Very rarely. Because so much of our training when we look at function has been thinking about concentric training. And that might be true if I'm playing hacky sack or doing something like that. Yeah, I'm going to use those muscles in that way. But for everyday walking, running, and athletic events, these muscles can tend to be more eccentric loaders. In fact, they're decelerating and loading the muscles. So these muscles, I tend to look at them in gait as more of something as the body walks forward and the knee goes forward, they're actually going to decelerate that motion a little bit and work with the gastrocs to straighten your knee when you're walking. So to think about stretching these muscles, we need to think about that function and then fascial continuities. Now, there's a lot of training out there talking about the lines of fascia and how there's 10 or 12 of them, and that is true, but when we look at function, that kind of changes a little bit, because the way the fascia is loaded is dependent upon the position that your body's in. And so when I look at the lens through structural integration, I'm going to look at that fascial continuity a little bit more, but let's face it, we're not trying to make perfect people on tables, and we're not trying to make perfect posture and structure. Although that's a goal, really, to change the relationships of the body, what we're really trying to create is we're trying to create proper movement. So if we think about these muscles coming up and becoming the IT band and the hip flexor and the glute muscles, and if the fact that they're walking and they're eccentrically loading, it might be kind of easy to think about, wow, what do they actually do in function? And if I'm not pulling my foot up and it's decelerating, we might be able to think about, wow, these actually cause a lot of hip issues. So if I wanted to do a stretch, you guys can try this. I would say let's put one foot straight down, and you guys can do this lower or higher depending on your flexibility. I'm not the most flexible guy, so I'm going to put it about this level. I'm going to put my foot up here. I'm going to get my pelvis nice and straight, like this foot is close to whatever you're stretching on, a chair or some stairs. I'm going to push my foot down, and then I'm going to bend like I'm stretching my hamstring. Now, if I keep my chest up and keep this foot down, I'm going to notice a real tight load all the way up here. So if I bend forward and now I take my body into transverse plane motion, like I'm going to bring this hip to this knee, then I'm going to go in here and stretch. I'll be like, oh my gosh, that's painful. In fact, this is the only good stretch that I've ever seen that actually really helps these as far as function and turning your body on. Remember, because if we're working with our clients and we're just doing passive stretches with them laying on a table, that's all fine and dandy, but if you're not standing up and driving the muscles through the planes of motion, the brain doesn't learn anything from that. So you can get stretched and feel good, but it's going to come right back. There's an awful lot of therapies and places out there that are doing a lot of static stretching. I think it's great, but I would rather work with the nervous system and the functional patterns that's actually causing that restriction, because A, I can give my clients this homework to do it on their own, and I don't have to spend time stretching them when their body's not learning anything from it. Now, I'm not trying to step on any toes, but come on, we're all about results here, and functional stretching is where it's at. So if you want to think about that, then in function, if I want to fire that chain and I'm running or I'm doing an athletic event, if I'm here and I'm going to jump or I'm going to grab here, this whole area is eccentrically loaded, I'm going to explode it that way. Or even if I just load my lower leg muscles and get them to fire by straightening my leg, you can see how that's a big rotator. So that is really important in function. Now that's not the only role, right? Because every muscle and every joint goes through 3 planes of motion. Internal rotation, external rotation, sagittal plane, flexion and extension, and also frontal plane motion. And these muscles do all of that. That's why when we put you in that stretch, it pretty much uses up almost all 3 planes of motion. In fact, you can even modify that by going side to side to get some frontal plane motion down there. Now, the reason that I like to point this out to people is because if you're an athlete and you're having chronic knee problems or ankle problems, this is an area that's very important. In fact, it's funny, I was watching some videos on Patellar Tracking the other day, and I thought it was really great, but the fact that the misinformation was saying, well, if you want to work with your patellar tracking, then you need to go out and put a pole here and just push your knee forwards and backwards all the time, because you're going to train your body to have proper patella tracking, but that's in one plane of motion. So what happens if I'm a baseball player and you throw me a ball and I go here? Oh, whoops, I just took my knee into rotation, or I throw it on this side, or I'm standing in my kitchen and I need to get a bowl of cereal and I'm reaching up here. Well, I just kind of destroyed that theory, because so many people talk about protecting the knee and the patellar ligament and the ACL, and then they want you to work out and keep everything straight, but in real life we never do that. So you're kind of training yourself to be strong in an area that really won't protect you, because all 3 planes of motion need to be worked here, especially if we're going in to do some type of rehab and we just have bands and we're going back and forth and moving. That's great, but what about the eccentric loading and exploding that actually are way more important? Now, you guys, if you want to really feel what this feels like, you guys that have taken our integrative anatomy class, you will know all about the reciprocal joints, like the right ankle and the left wrist are reciprocals, and the right knee and the left elbow are reciprocals. So if I want to experience that ankle and those muscles moving through a full range of motion, the best way for me to do that is move these opposite reciprocal joints through planes of motion. So instead of sitting here and trying to focus and get my ankle to move, I can just stand on that leg and start moving my wrist and my ankle through all these different planes of motion, and that's going to be the best way to drive my ankle and my knee through all those planes of motion. And if you think about how, knee problems 90% of the time, if not more, it's because the ankle and the hip don't work. So if we've got muscles here that are restricting the ankle, and then that's going to tie up our IT band and our hips, we're going to have knee problems. I've never seen a knee problem ever, I don't care which part of it is, that didn't involve some issues in the anterior and lateral lower leg. So if we want to think about ways to work that out better, I could even take a sort of wedge in my clinic and stand on that this way and drive those planes of motion, or give my client some more movement, and then I could stand on the other side, right? Just really working that inversion and eversion to open those different planes. So I hope that helps you guys understand the functionality of how important these muscles are, and maybe thinking a little bit more about how you're going to use it. Because if you understand structurally what's going on in those lines of tissue, and also the functionality of that, you're kind of going to go, wow, this is so important to neck issues and thoracic spine issues and hip flexor issues. And in fact, I wouldn't say it's the cause of everything, but it can also compensate here as well. If you have somebody that has a really tight hip flexor on that side and going through gait, that's going to end up externally rotating the leg to get stability and tightening up these muscles too. So I never want to say this is a be-all end-all, because we can chase this all over the body depending on what the priority is, but functionally you've got to be addressing these muscles if you want to have success in the rest of the body. So lastly, I want to talk about the energetic aspects of the lower leg. Down here we've got the stomach and we've got the gallbladder meridians running up the side. So if you're an acupuncturist, you already know, hey, we're going to hit gallbladder 34 right between the tibia and fibula here, and whether you're using microcurrent or needles, you can clear a lot of that congestion in the meridian going through there. Body-centered psychology, we know the knees are about fear and willpower. They're governed by the kidney mostly. And then in the ankle, we've got the kidneys, the gallbladders, and basically every meridian. But for this, what we're talking about here is mostly the stomach and the gallbladder. Now, I've always found it really interesting. You know, in Chinese medicine, we talk about the gallbladder dealing with frustration, and also it runs the part of the brain that works with decision making. And it's balanced on the opposite side by the kidney meridian, which is fear and willpower. So I always noticed, you know, working with athletes in high school, and they're trying to figure out which college they're going to sign with, and there's a little fear about that that can tighten up their lower legs and link it to some ankle problems. Same with guys, you know, deciding if they want to leave the college early and go sign with the pro team, or even a pro athlete wanting to leave the team to go with another contract in another place. That can happen. So you guys that do your UN method, your body talk, your Psych-K, all that, you're going to have a little bit more insight about, wow, this is interesting about ankle and knee issues. But the go-between there are all these muscles. And one last thing I want to leave you with that is, if we look at body-centered psychology a little bit in Chinese medicine, the anterior muscles here, lateral muscles, are mostly ran by the water element. That means they're going to be kidney and bladder issues. So the funny thing to look at is people that have a lot of restriction in here tend to have control issues. Because if you're afraid to make a decision and your ankle's all about moving through life, right? Standing your ground, moving through your life, going forward, going backwards, going around things, and the knee's about fear or willpower. If you've got some fear about what you're supposed to do, standing your ground, not going forward, you're going to get a little tight, and that leads to fear, and fear is what ultimately leads to control issues. So I always find it really interesting. My high stress type A clients are the ones that are going through bad relationships yet again, always have tension in here because they've just adapted, and they think that trying to control the world and control other people is the way it works, and it shows up in those muscles. So that's some other food for thought when you're working with your people. And I hope that helps. This is just the tip of the iceberg. I just wanted to give you guys a little bit of information about how we look at muscles with Trunamics. And of course, in our structural dynamics class, we do this for every part of the body. So I hope you guys join us soon, and I hope this helps out. Hey everybody, I wanted to work on to the actual application and treatment phase of our lesson today for the lateral and anterior lower legs. So I just can't focus on this area when I'm working on it because, you know, there's no real antagonistic muscles in the body. They're all agonistic as they load and unload and eccentrically contract. And since we have so many muscle compartments in here, I often feel it's really important to kind of treat, if I'm just going for this part of the body, I've got to get a little bit up, above, and around for that. So the first thing I'm going to start off with is just doing some typical myofascial release type stuff. What I'm going to do is I'm going to grip the muscles here on the lateral side and just kind of pull it like this. I'm actually trying to, you know, envision that I'm just trying to pull those muscles away from the tibia a little bit. So I'm just going to kind of hold that in each spot, sometimes for a minute or two, and you be careful when you're doing this because this can cause people an awful lot of pain. They've had such a lack of movement in here that there's all kinds of of just restrictions and things stuck together in there you got to work with. So I just kind of start out this way and going along and holding this. Now I would hold, like I said, each position for 2 or 3 minutes. I'm just giving you a little bit of thoughts about how to work with this fascia on the lateral part. And since all these muscles are all together and this fascia is in all these compartments, I'm going to go ahead and externally rotate her leg and kind of grab it and do the same thing and just kind of grab the muscle to release a lot of this fascia underneath the tibia and in between these compartments that run, you know, through here, the tibialis posterior, in front of the calf and gastroc, and all the way over here. So we're just going to kind of hold those, and again, in therapeutic state, I might take the forefoot and pull it up and give it a little bit of dorsiflexion to create some more torque in that fascia to open that up. And I'd even move all the way around down here to the lower calf and the Achilles tendon. So once I've spent a few minutes really opening that up, what I would do then is I would take my fingers, and I just want to kind of spread the superficial tissue. So I'm going to take some super thick massage cream, and I'm just going to take my fingers. I call this the Wolverine Technique, but not to push too hard with your fingers, but it's just a great way to go in and stimulate those proprioceptors in her brain. Because as with all body work, you know, there's so much research showing now that we're not actually lengthening fascia and letting it go and breaking up adhesions. What we're actually trying to do is kind of get out of that ego thought that we're healers, but that we're just putting information into our body. I'm just kind of giving this lower body area a sense of lift. Since so much of us are in flexion in the front part of our body, I like to just release this connective tissue up and really give this lower leg a sense of lift. You can see as I'm working here, I've got this turned in a little bit because as this tension from the IT band, all these muscles down here, it's short and it's going to externally rotate the leg. So I'll just work my way all the way down here and clear all of this fascia on this lateral aspect. And you'll find some sticky areas in there that are, you know, just a little bit more stuck than others, and just spend some time there. Your patients will really appreciate it, and you'll really get a lot of this superficial tissue mobilized and opened up. You can spend a lot of time too around the origins and insertions, of course. You can even take this up on the lateral aspects of the knee, where that hamstring comes across and the IT band. In fact, you know, so much like we talked about earlier in the video of this IT band issue and lower back sacroiliac joint issues is because this is not moving. This is getting overloaded. So, you know, that's why I kind of laugh when I see people treating their IT bands and using foam rollers and getting massage in their IT bands for the pain. That usually makes it worse because it's an area of fascia and tendon basically that the body, these muscles attach to. And if it's sore and long, it's because it's locked long. It's working too hard. The last thing we want to do is open that up even more. So in a real massage session, of course, you could carry this up into the quads and go all the way out there. So now this anterior tissue is pretty prepped. You can even come down into the tendons, down in here to the foot, and open up all these attachments that are going to come down and cause our foot dysfunction or come from the foot. So we're just going to clear that up. So next I'm going to move to a seated position because typically, you know, these muscles are really thick in there. I mean, I may need to get to some of that restriction this far down, and it's not enough to do that with fingertips. So we're going to break out an elbow and take some time to really get through there. So I'm going to move to a seated position now and continue that. Okay, so now we're going to go and focus a little bit deeper on the sides. We got all that superficial tissue opened up. What I like to do is just kind of access, you know, and look at all the different planes of motion in the ankle, and that kind of gives me a hint of how much tension and torque is there through that range of motion. But everything's okay once we loosen that up. So what I'm going to do now is, like we said, a lot of this tissue is really deep in there. We need to open that up, and this tissue is so tight and hard, right? It's that fast twitch type of muscle that's just really hard. It's hard to get it tight, but when it does, it's hard to get out of there. So I'm always going to work with what my client can stand, but sometimes the best way to get in there is to just get your elbow in. Now, my mechanics aren't perfect for this, so don't bag on me for that. It's trying to fit this in the camera that's the hard part. You can do the standing up, sitting down, however you want. I'm lazy and I have some shoulder issues, so I typically do this laying down. So what I'm going to do is sitting down, not laying down. So what I'm going to do is I'm going to hold the ankle and I'm going to internally and externally rotate it as I take that elbow right up at the attachments. So I mean, there's times that I'll be using 1 pound of pressure, there's times I'll be using 50 to 20. Honestly, as long as it's not causing damage and my client can handle that, especially a lot of athletes, you're going to have to get in there pretty deep to really open that up. And I'm not so much a fan of deep tissue work because I think a lot of people just go really deep and miss a lot of the stuff that's there superficially. But I like to really get into where the issue is. And sometimes if you don't get down to these deeper shin muscles and get in pretty nicely, you're going to have issues keep coming back because you're not getting in deep enough to work with their brain to go, oh yeah, bring that awareness of their nervous system into these tissues, to let it go. Now, as I feel some tension there, I might just passively find out where that's stuck. That's not really going to enhance my treatment at all, but it's going to help me to find the angle that I need to work on. So everybody's going to be completely different. All these muscles are going to kind of spiral and get stuck in 3D, so I might find an area that's tight and just work with that, clear that up. Now she's got a little bit more of a restriction right here. So I'm just going to get in there with my elbow, and of course let me know if there's anything that's too much or too tight, because we don't want to be torturing our clients. Remember, we're working with their body, we're giving them information. And if it becomes so painful they have to have an out-of-body experience to get through your session, it's probably not going to work, and your client won't be real happy either. We want this to kind of feel like that necessary pain. Okay, that's released pretty good. Now I'm going to come down around the fibula. I can use my elbow here, but I've got pretty strong hands, so I'm going to get around kind of in these peroneal areas and just open this up. Just really clear that out. So we started out superficial to deep because, you know, the way that the muscles and the fascia work and to expand, if we just go in here deeply and don't get the external stuff, it's going to be trying to blow a balloon up into a box. That tissue is not going to have any place to go as it releases. So I can just carry that all the way down. So my goal here with this is to think about opening this up, and then that's going to take a lot of that pressure off the IT band and also the hip. Now, one thing I will tell you, every time I work on these lower leg muscles, I'm going to either start out or end up in the hip flexor, because these two go together. One can cause the other, but you'll never find them not together in some capacity. Where you have lower leg and calf tightness, you're going to have hip flexor tightness. Like, there's a lot of people out there that work on stretching their gastrocs or have used, you know, different types of braces or things that they put on to lengthen their calf out, and that's all fine and dandy to sit around in that, but functionally, if you don't release your hip flexor, your gastrocs and soleus are never going to completely load through gait anyway, so they're just going to tighten back up. So you really need to spend time with your hip flexors. There we go. So I've got that release. Typically I am going to work up to give a sense of lift through the lower leg, but with her, she had a little bit of tension kind of coming in between the muscles there, and it was the best angle to get that. So I don't really need to spend more time with this. I just wanted to think about giving you guys some approaches. So now that you understand structurally what's going on from here, and also functionally, when you go in to release these muscles, you're just not ignoring them anymore and going and chasing sacroiliac pain or foot dysfunction or IT band syndrome. You're going to look at these as a very, very major cause of all of that, especially thoracic, low back, and neck issues as well. So knowing why you need to release tissue is a lot better than just going in and releasing tissue because it's tight. This could be a primary cause or a secondary cause. I've actually seen people that have had whiplashes and upper cervical issues, that they've had to tighten up their lower legs to jam their chin forward so that they take the pressure off their spine, or their atlas and occiput. So whether it's a chicken or an egg, it doesn't matter. You need to treat it all most of the time, but that's why we tend to look at kind of what are the priorities to clear out, and you can get a lot more work done. So thanks for joining us, and I hope you guys understand the anterior and lateral aspects of the lower leg, and we hope to see you in one of our Trunamics trainings in person soon. Thank you.